My first guest is Dr. Daniel Hackett, who is an orthopedic surgeon with Kentucky Bone and Joint. I get all that right?
That's all right.
And you do all kinds of orthopedics, but you have a specialty in shoulders and elbows.
Predominantly shoulders and elbows, but I do a little bit of everything right now.
And I talked about funny bone. Why does that hurt so bad when you hit your elbow?
So just as you know, it does. There's not a whole lot of meat in between the skin and that bone, the olecranon, and but just as well as you know, there's also it all does calm down. So I usually don't see too many people that actually have hit their funny bone unless they've hit it a little bit harder than normal. So luckily, it's just the contusion of that olecranon that causes a little pain. But just as you know, it calms down after a few minutes of angst.
Well, you do see a lot of other elbow problems. Tell me about some of them.
Right, so you know the elbow is comprised of three bones: the humerus, the radius, and the ulna, and those, along with the ligaments and the tendons that all traverse across the elbow joint, provide the inherent stability of that joint and allow it to function properly, so that you can raise your hand up to feed yourself, so that you can throw a baseball pitch, so that you can serve overhand with a tennis racket, and all those things are important. And when one of those things starts behaving abnormally, such as the ligaments or tendons, all of those things that aren't working in concert with one another, will allow people to come see me. And so, I see people for bony issues with their elbow, as well as tendon and ligament issues with their elbow.
Now you mentioned tennis racket and baseball, two of the things that we in Central Kentucky do a lot of. So we've heard the term tennis elbow. What is that, and what do you do about it?
Right. So tennis elbow is by far the most common ailment that people come to see me or any orthopedist about, and it's really about 1 to 3% of patients annually. It's really equal in men to women, and it's usually in their dominant extremity, and it's commonly known as tennis elbow just because of the fact that about 50% of patients who play tennis regularly will at some point in time experience some of this lateral epicondylitis. And essentially what it is that the tendons on the outside of the elbow, or the lateral aspect of the elbow, they become affected from things such as backhand swings in tennis, or with excessive or repetitive gripping type motions, such as picking up boxes that people might have from working at a warehouse commonly.
So short of stopping doing what you're doing, are there other treatment methods?
Right, so obviously that is the easiest thing, but there are activity modifications that tennis players can do, such as changing their grip or changing the tension on their strings. Aside from that, the common things that work for any tendonitis, and that's RICE therapy, which is rest, ice, compression, and elevation. Additionally, using things such as NSAIDs. And once those things aren't effective, that's when patients usually come to see me, and we can start trying other things such as cortisone injections, getting them into physical therapy, or trying things like braces, which can either be braces that are near the elbow or those that are at the wrist that allow you to not move those tendons that are being stressed as much.
Now, you also mentioned baseball and throwing the baseball, and we have a lot of little league here in Kentucky, and a lot of, I guess, kids get some elbow injuries from pitching too much, pitching the wrong way.
Well, it's becoming more and more of an issue, and the reason being is that it's patients and kids especially are playing just one sport year round, and that continuous excessive stress on the inside aspect of patients' elbows, especially those that are pitchers, and as we get stronger and as we become more developed, those elbows just are not effective at fighting that stress that is repetitively on the inside aspect of the elbow with pitching, especially throwing more than 80, 90 pitches a game, or those that are kids that are throwing greater than 85, 90 miles an hour before their growth plates have fused. All those things can really stress the inside aspect of the elbow and cause some issues.
What do you do with that? Short of surgery, or do you even operate on kids?
So it is. There's kind of a continuum with how these injuries happen, but if they're patients who have yet to have their growth plates fused, commonly what happens is the growth plate will just actually pull off of the humerus bone. However, as we become more mature and the growth plate's fused, the ligament is the one that's commonly affected, and that's the one that we hear about on ESPN and SportsCenter with talking about somebody having to have Tommy John surgery, and that's the ulnar collateral or the medial collateral ligament that usually gets ripped off of the inside aspect of the humerus bone or the top portion of the elbow, and it doesn't allow the patient or the pitcher to create as much velocity with pitching. So,
well, that's all great information. It's a lot of great sports information, a lot of great elbow information. Thanks for coming in.
thank you.
All right.